The Performance Triad is an enabler of our entire transition to System for Health. And so with the Performance Triad, what we're looking at is if we can improve the health literacy of our soldiers and their family members, I believe people will make better decisions on how much sleep they get and the impact of that sleep, how active they are, and what do they eat so that they can eat a little bit healthier. We're not telling people to stop doing things or deprive themselves. What we really want is people to make better choices and have it easier to make healthy choices. And so the Performance Triad is something that we believe that leaders, if they manage the sleep, activity, and nutrition of their soldiers, that they can optimize the performance of their soldiers and better optimize their mission. Right now, we have a very robust healthcare system, and we need to continue to do that so we can provide the right care on the battlefield as well as across our military treatment facilities. But we have a tremendous opportunity to take health outside of our bricks and mortars and extend that into the life space where people are making decisions on how they sleep, how active they are, and what they eat. And we believe right now the tipping point in the United States is our ability to help improve the health of our nation. You know, you have 525,500 minutes in your year that you can make decisions on sleep, activity, and nutrition. Only 100 minutes is about what we can affect in healthcare because you come to see your physician either 1 to 5 visits a year for a 20-minute visit. The remainder of those minutes are where you make their decisions of sleep, activity, and nutrition, and we're calling that the life space. It's where you live, it's where you labor, and it's where you love. You know, leaders, they do a phenomenal job every day. They're responsible for the health and welfare of those that they have the privilege to lead. And so what we want to do in Army medicine is partner with our Army leadership so that they can ensure that they are directly improving the health of their soldiers. And by doing that, when we partner, we can look at improving their activity levels, their performance level, their brain agility and cognitive functioning. We believe that if we can focus on this and that our leaders can look at sleep the same way they do personal protective equipment and risk management and water discipline, sleep is the same critical element in their ability to enhance the performance of their soldiers. I have the privilege to be able to serve as the Surgeon General, also to serve as the Department of the Army Staff Officer, and then the Commander of the Medical Command. And during those 3 roles of meshing those together, what I found out when I assumed the role of the Surgeon General is that my passion really is this transformation to health, because I believe we can make a huge difference in improving the health of our Army and the health of our nation. And so I thought if I'm going to talk that, I've got to live it. And so I had to change my behaviors in sleep from being a leader who had 4 to 5 hours of sleep, and I did that for years, to someone who actively works to get 7 hours of sleep. I use a technological device that monitors my sleep and lets me know how many times I wake up at night. I make decisions that I can now tell that when I have less sleep, I'm not cognitively as effective as a leader as I thought I was when I was getting less hours of sleep. I've improved activity throughout the day, so I've moved the mental mindset of going to the gym for an hour to actually just trying to be active throughout the day, 10 minutes every hour, vice knocking it all out at one time in the morning. And then I've completely changed how I eat and really cognitive of improving nutritional choices. And it's made a difference. It's made a difference in my energy level. It's made a difference, I believe, in, well, definitely in losing weight. And more importantly, I think it's made a difference because our command is just very passionate about this, and I've seen it improve the lives of our civilian and our military across our medical command. So our vision when we talk about moving from healthcare to health is we are extending our capabilities of health out into the life space that I've talked about, where sleep, activity, nutrition decisions are being made by our soldiers and their family members. So as we move health and take technology to marry that up with the improved health literacy, we're then also standing up wellness centers so that that is another touch point. So soldiers and their families, as they make those decisions, can also go to our wellness centers and get further education and support in their overall health and knowledge in that area. And then it ties into our military treatment facilities. And so whether it's our patient-centered medical homes or it's our specialty or subspecialty care, we're wanting to incorporate sleep, activity, nutrition into every patient touch point and every interaction so that we can use the entire system to improve the health of our beneficiaries. You know, I believe that when Americans are educated, people make the right decision. And so I think part of it is just people need to understand the research and the evidence that 7 to 8 hours of sleep, how that really does improve your cognitive functioning, how it does allow you to increase your performance. We have been able to make dramatic changes across trauma care, oncology, and rehabilitative medicine. We now have the opportunity to make tremendous advances in the area of health and brain health, and that's where we're focusing. And so I believe it's not so much that it's bad habits, as much as I believe that if you inform individuals and you make it easier to make decisions that are healthy decisions, people will start incorporating that into their daily choices. On the exercise, it's more of we now park farther away because we count our steps. So the big goal is to get 10,000 steps a day, and then actually once you do that, you up it on yourself because you're so competitive with yourself. So then it's 12,000 or 15,000 and try to get 20,000. So we park further away. We take steps that I normally would take an elevator. We look at taking walks together. It allows us to be able to talk as a couple and have time for that. Just incorporating movement throughout the day. So it's not that we're adding that you have to go to a gym. What we just want is people to be more active throughout their day. You know, when I first took over as a Surgeon General, one of the things that I did is I actually stopped eating processed foods. And so I thought I'll do this as a slow step and started introducing more fruits and vegetables into my decision choices. I started eating breakfast, which is an important meal of the day, and I now eat 3 meals a day and frequent snacks throughout. And so during the time period, my actually health habits have dramatically changed. I've lost 17 pounds without dieting, and it really has been just changing what I'm eating throughout the day. You know, the changes that I've made in the areas of sleep have really been because I now know exactly what I sleep. Prior to wearing a device that told me what I was sleeping is I would guess that I get either 6 hours or 7 hours of sleep. And then when I started monitoring, I really realized I was about 5 hours, and I was waking up frequent times during the night, so it wasn't quality of sleep. I now make decisions at a certain point. I stop what I'm doing and say, okay, it is more important to get seven hours of sleep than it is to try to study one more information paper because I just realized that I'll be much more alert if I have that, and my brain will be much more agile, and I think my ability to think strategically, I know it has improved as I've improved my sleep. So I've made those adjustments, and you only have so many hours in a day, and so you have to just kind of prioritize what's important for you to be able to lead your command effectively or to be able to accomplish whatever your personal mission is, and you incorporate these lifestyle changes. Part of what we've really had a movement over the last several years of pushing as much capabilities outside of our bricks and mortar. So we have our physical therapists that are being aligned to our brigade combat teams. We've moved behavioral health we have embedded behavioral health that we've moved into our brigade combat teams. So we're trying to take as much health and health care and push it where our soldiers are making those decisions of activity. So as we have our physical therapists help them, with improving the way that they exercise, trying to decrease injury prevention through knowledge and stretching and making sure that they have the understanding of the mechanics. When you hydrate, you decrease the amount of injuries because your body needs that fluid. When you have the amount of rest, you decrease the amount of injuries just because that's one area of risk mitigation. So it's incorporating all of this education and technology and the individual choices together. If I could go back in time as a mother, I would have done a much better job of, I cooked dinner every single night for my kids. I probably didn't make the healthiest dinner choices. I would have incorporated much more of fruits and vegetables in everything that we did, so it became a natural decision for my kids to make instead of learning that now when they're 19 and 20 years old. I would have made decisions of being focusing probably a little bit more on my sleep, activity, and nutrition earlier in my career. I'm actually pretty healthy. I'm not on any medications in that, but really what I want to do for individuals is to change the conversation of when you might get a disease to if you ever will get a disease. And that's what we're trying to do, is if we can improve one's health early on and make health habits just a part of their life, I believe we can change the whole conversation of whether or not they get a disease, and we can keep someone healthy for as long as possible. You know, we are a nation where we spend more dollars on health care, and we're becoming less and less healthy. We've got a rising trend in obesity rate for our children as well as our adults. We have a population that is, diseases are increasing across Americans, and our healthcare system is not sustainable in the direction that we're moving. So we have an opportunity to really look and say, how do we, within the military, partner with the United States to really improve the health of Americans? And so we need to look at how we educate within our school systems. We need to look at how we build our communities, how engineers are designing facilities to make it easier to do exercise and walk and be active. We need to relook our industries and leverage technology to improve health. And we need to look at how we incentivize our industrial base so that we're more focused on health. That will then, I think, increase the health of America, but also increase our industrial base as well.